When we do get quorum, I will officially move House File 401 to be re-referred to the Committee on Health and Human Service Finance. But until then, we will go forward with the presentation. Representative Fenton, welcome to the committee. If you could please state your name for the record and give us your testimony.
Thank you, Mr. Chair. I'm Representative Fenton, Kelly Fenton, for House File 501. What this bill is appropriations to voice response, suicide prevention, as well as the Text for Life. Members of the committee, you know, when my daughter was about 10 years old, I was driving her to a party, and we came across what was suicide. Somebody had literally drove their car to the overpass and literally got out and jumped over. And it raised a lot of questions with my daughter, questions I wasn't really comfortable answering at the time for a 10-year-old. But I did say something to her: no matter how bad it is, no matter what happens, just know there are always people that love you and somebody out there you could talk to. And after she absorbed that for a while, she asked, what happens if there's nobody around? So this is where House File 501 comes in, and I'm going to turn it over to my testifier, Mr. Eastwood, to tell you about the work they do. I've had the pleasure to actually tour the facility. While I was there, I saw the call center in action, and it's astounding the type of work that these members of the organization do. So with that, Mr. Eastwood.
Welcome to the committee, Dr. Eastwood. If you could please state your name for the record and give us your testimony.
Mr. Chair and members of the committee, my name is Matthew Eastwood, and I'm the CEO of Canvas Health, a community mental health center located in Oakdale, Minnesota. I want to thank Representative Fenton and the co-authors for House File 501. Canvas Health was started as a nonprofit community mental health center in Washington County almost 50 years ago. We now offer over 35 clinic and community-based programs in Washington County and across the entire metro area. In addition, we offer statewide voice response and text response crisis services. I'm here today to testify on HF 501, appropriating funding to stabilize the voice response suicide prevention and mental health crisis response program, and to expand the statewide text message crisis response program. These services are provided through Crisis Connection, a telephone and text response center located in Richfield, Minnesota. Crisis Connection was founded in 1969 and was acquired by Canvas Health in 2010. We presently provide immediate crisis access to persons at risk of suicide or harming others, and we have a mental health crisis with a mental health crisis with the mission to create a place in which no one in crisis will ever be alone. Both the voice response and text response services are staffed by qualified professional and trained volunteer counselors who respond 24 hours a day, 365 days a year to individual inquiries. All crisis counselors are certified in ASSIST, which is Applied Suicide Intervention Skills Training and Evidence-Based Practice. Services are free and confidential to the callers and easily accessible to anyone located in Minnesota. Trained counselors triage, stabilize, and assist callers in reaching a place of emotional and physical safety. Counselors refer individuals to available community resources where they're able to receive the long-term support and therapy and other services that they may need. Crisis Connection is the only crisis center in the state of Minnesota that's accredited by the American Association of Suicidology and Contact USA. We're the only response to all voice response calls for the National Suicide Prevention Lifeline for calls originating in Minnesota. We currently administer the Minnesota Gambling Helpline, the Sowing Seeds of Hope Rural Line on behalf of the state of Minnesota. In addition, we have multiple incoming text lines, including the Text for Life program. These other lines include the University of Minnesota Crisis Text Line and the Minnesota Gambling Text Line. We deliver services through a combination of 26 professional staff and over 100 volunteers who offer over approximately 12,000 hours of their time every year. We contribute to community well-being by responding in the following ways. In 2016, we provided almost 36,000 telephone conversations to people in crisis and responded to had 11,000 text conversations. Those 11,000 text conversations equate to over 400,000 individual text messages. Over 6,000 of the people we dealt with viewed themselves as being at high risk to suicide. 26,000 of them stated they were in a mental health crisis. 397 of those people, more than one a day, were referred through 911 to law enforcement and emergency medical professionals. We made over 1,500 referrals for mobile crisis, and we referred over 13,000 people to local, community-based mental health substance abuse services. We have significant brand recognition. We're often marketed by the media, by counties, by the state, and by private providers. As you know, according to the Minnesota Department of Health, the number of suicides in Minnesota has steadily grown over the past decade. It has continued to increase, and it represents a serious public safety and public health issue. According to the Minnesota Center for Health Statistics, suicide was the 9th leading cause of death in 2013. In 2014, 683 Minnesotans died by suicide, with an age-adjusted suicide rate just slightly below the national average. Tragically, American Indian youth in our community between the ages of 10 and 24 have the highest age-adjusted rate of suicide in the state at 30.7. They are more than 3 times as likely to die by suicide as are their white peers. In addition, we have found that, and statistics point out, that men in the age group of 50 to 64 have the second highest age-adjusted group rate of suicide at 29.5 per 100,000. Research shows us that 90% of these people have an underlying mental health or chemical health issue that needs treatment. We know that behind each of these suicides is a story of a loved one, a neighbor, a friend, a colleague, a family member. And for these individuals, not only is the loss shocking, painful, and unexpected, but the grief that ensues can be intense, complex, and long-term. The total effects of death by suicide can be felt across communities and across generations. We know these deaths can be prevented. We know that intervention works. We know that treatment works. We can help solve that problem. The request before you really contains 2 parts. It's support for the voice response service and the text response service. The voice response service does not receive base funding from the state of Minnesota to operate. In 2016, we received $8,487 from the Department of Agriculture for the Sowing Seeds of Hope rural line, and $125,000 from the Department of Human Services for the Gambling Helpline. In addition, we responded to over 9,000 calls for the National Suicide Prevention Lifeline and received $3,500 from SAMHSA for that work. Other funding for voice response comes from a small group of counties and entities who purchase telephonic services. The voice response service has experienced regular losses over the entire time that Canvas Health has owned them. These losses total over $900,000 at this time and are, in the long run, unsustainable for an agency of our size. This bill would move the funding structure to the state, similar to how the text service is funded, and anticipates a call answer rate would increase to 50,000 calls per year. These funds would sustain the voice response operation from now and into the future, ensuring the service would continue. Thanks to the efforts of Chairman Schomacher and others, the text response services did receive $1.125 million of funding during the 2015 legislative session. And while we greatly appreciate that and have been able to do a lot of good work with that, that amount was actually below the original request and less than we anticipated it would take to cover the entire state of Minnesota. And that is what we have found to be true. However, with these funds, we have been able to provide text response services and hire regional coordinators to cover 54 counties and all of the tribal nations in the state of Minnesota. The proposal before you today would increase the availability of Text for Life regional coordinators to conduct education and outreach to the central quarter of the state. I believe you have a handout that shows you that in your packet. These regional coordinators focus on suicide prevention strategies, mental health education and awareness, and helping communities understand how to access mental health and crisis resources. The use of regional coordinators is targeted at serving school-age youth who commonly use text messaging rather than telephone as a way to communicate. This proposal expands the use of regional coordinators to be statewide and provides necessary capacity within the tech center to accommodate thousands of additional text conversations. It's anticipated the greater text volume will be created by the increased awareness generated through the regional coordinators' work. Mr. Chair and members, I thank you for this opportunity to come before you this morning for your consideration of House File 501. This concludes my testimony, and I'm certainly willing to answer any questions you might have.
Thank you, Dr. Eastwood, for your testimony this morning, and thank you for the work you're doing on behalf of those teens who need a little help. Question for Dr. Eastwood before we move on to other testifiers. Representative McDonald.
Thank you, Mr. Chairman. Question for the testifier. Do you have any numbers and facts of the veterans who have committed suicide? Those who are returning from the Gulf Wars, the Iraqi Wars, and particularly the ages of, say, 19 to 25?
Dr. Eastwood.
Mr. Chair, Representative, I do not have those specific numbers with me today. I can certainly try and track those down. I know that the number of veterans who use our service is relatively low, but that we did expand that service through the NSPL and agreed to take that, which actually moved us from funding of $2,500 to $3,500 per year. It's an ongoing struggle, and we have actually spent a fair amount of time historically working with the Minnesota National Guard to try and increase their rate of usage of our services and to coordinate with them.
Representative McDonald. Representative Liebling.
Thank you, Mr. Chair, and thank you very much for your presentation. It was very compelling. I just wanted to ask you about a statistic that I heard that went by pretty fast, that you said that Native Americans had a suicide rate of, or youth maybe, 30.4%. Could you just clarify, what was that 30.4% that you mentioned?
Dr. Eastwood.
Mr. Chairman and Representative, yes, the statistics on Native American youth are tragic and very troubling. The statistic is an age-specific rate of 30.7 per 100,000, and that's the highest in the state.
Representative Liebling.
Thank you, Mr. Chair. Okay, yeah, that is shocking enough, but I thought you were talking about a percentage. So I just, thank you for clarifying that.
Representative Moran.
Thank you, Mr. Chair. So I'm looking at this map here. Can you kind of like explain this map, the color coded and what that means? And then kind of like describe for us what this last line means.
Dr. Eastwood.
Mr. Chair and Representative, yes, the map before you, the color-coded areas simply represent a different region for us where we have a regional coordinator. We typically hire someone from the local community or within that region who is known to that community and a part of that community, and they then do outreach across that area. In addition, you'll see the light blue noted areas are the different tribal communities. The gray area is the area that is currently not covered by the Text for Life program because we do not have a regional coordinator there.
Representative Moran.
Mr. Chair, thank you. So what we have in the areas that are color coded is one regional individual who is picking up text for that region.
Dr. Eastwood.
Mr. Chairman, Representative, no, I don't think I was very clear about this, so let me clarify. All of the text messaging currently comes into our call center in Ridgefield where we have our staff located. The color coding and the regional coordinator is an individual who's a public health trained educator who lives and works in that area, and we contract with either the public health agency in that community or the community health center to employ that person. They then are going out and doing educational programs in schools and in the community. They're not the receiver of the text message. They are training children how to use the tool itself. It's really the one time when at a school assembly, all the kids are asked to bring their phones with them. They're taught about Text for Life. They're taught about how to access Text for Life. And they're asked all to put that into their phone, obviously in order to help if one of their friends needs this service. So they've all got it in their phone, they're ready to go with it. That's the role of the regional coordinators, to do the education, build ties among different community partners and different stakeholders that we have, and bring people together around building the Text for Life program. But they're not actually doing the answering of the text messages themselves.
Okay.
Representative Moran.
Thank you, Mr. Chair. So how effective is that? Because these areas, like in the northern east area here, it's a pretty big area for one individual to go out and do an educational presentation. So how effective do you think you currently are with the work that needs to be done regionally?
Dr. Eastwood.
Mr. Chair and Representative, those are some very large areas, and it's typically based on a sense of how many school districts and the population in that area. And certainly there's a lot of area to cover. I think we're really quite effective and have been a lot more effective during the last year and a half or so when we have really been able to bring a more professional approach, I think, to some of the regional coordinators. We've set some very clear standards for them through our work with Department of Human Services on this, to set standards for how many outreach meetings they're doing, how many health fairs they're doing, how many schools they're getting into. And it really is their task. This is their focus, is to be an educator and to be out on the road, meeting with people, getting themselves in front of kids. And I think it's fairly effective.
Okay.
Representative Moran.
Thank you. That's it.
Representative Olson.
Thank you, Mr. Chair. So I had a question. Well, first of all, I just want to say that this is wonderful that we're talking about this. This is an issue that's affected my life, as it is, I'm sure, a number of us in different ways. So I really appreciate it. And I've actually heard about this program in my area, in my district, and so the word is out and people use it. So wonderful. My question is for Dr. Eastwood. So in the bill, it just talks about text message suicide prevention and not specifically the Text for Life. So could you just speak to, are there other programs, are there other organizations, entities that do similar things in these areas, or is this some, just speak to that piece of this?
Dr. Eastwood.
Mr. Chair and Representative, there certainly are some other organizations on a national level that do this work. Text for Life is really the predominant program in the state of Minnesota. We do have some other text programs that are smaller and more focused in nature. For example, we work with one suburban police department that uses the text platform that we have for their, I'm going to blank on there, basically for their SWAT team to operate out of their command center, so that like most of us, as we're aging, so apparently are people who are taking others hostage, and they won't respond to the telephone call anymore, but they will respond to a text message. And this particular agency has found it helpful to have that capability in their crisis center, and so they can text or call. So there are some small one-offs to it, but the predominant program we have is the Text for Life program.
Representative Olson. Representative Flanagan.
Thank you, Mr. Chair. Dr. Eastwood, I had a question, as clearly we have really stunning rates of suicide in the Native community. And as I look at the map and the gray areas, it appears as though there's 4, maybe 3.5 reservation communities that are not covered currently by Text for Life, where there's not a regional coordinator in those areas. Is that correct?
Dr. Eastwood.
Mr. Chair and Representative, actually, we've done something a little bit unique there, in that all the tribal communities are covered, in that certainly where we have the colored area, we have a regional coordinator there, but we have also hired more recently 2 tribal liaisons who work with us to support the work of the regional coordinators, and where there is not currently a regional coordinator, they are connecting and working with those tribal communities.
Representative Flanagan.
Thank you, Mr. Chair. So I guess to that point, who are these folks? Are they connected to the tribal community? Are they tribal members themselves? Just sort of looking for a little additional information about the cultural competency of some of these folks in the program, because I think it's clearly important. But as we're looking at the highest rates of suicide for this community, it's probably critical, in my estimation, that folks have that expertise and those connections.
Dr. Olson. Dr. Eastwood, sorry.
All right. Mr. Chair and Representative, the individuals that we have hired as tribal liaisons are members of the tribal nations, members of those communities. In addition, we have brought training into all the staff in the tech center and the call center to train them to be more culturally competent to work with Native communities. It was really a shortcoming and something that we lacked, and I'll be honest that we made a lot of mistakes when we originally began working with the tribal communities. They have been very gracious and willing to overlook those, and then to join with us and partner with us, and to help that work move forward. And so we as an agency and as an organization are much more skilled today than we were even a year and a half ago. But we see the need to work with people who know those communities, understand those cultures, work with them, and want to partner with us to do that work.
Representative Flanagan.
Thank you.
Representative Franson.
Thank you, Mr. Chair. So my question has to deal with data privacy, and I'm just wondering how long those texts are on file for, if they get destroyed after a certain period of time. Is there any worries that an individual who reaches out in a moment of distress has to worry about those text messages showing up later in life?
Dr. Eastwood.
Mr. Chair and Representative, that is a piece of information I do not personally hold. If you'd like, I could bring the manager of the Crisis Connection forward to answer the more fine-grained detail.
Mr. Chair.
Representative Franzen.
And to the author, is this anything that you're aware of, or about the messages, they get destroyed, how long they're kept on file for?
No, but we can bring someone forward that can talk to that for you.
Representative Fenton, is this someone who's already going to be testifying?
No.
Okay, then welcome to the committee. If you could please state your name for the record and help us with this question.
Hello, my name is Laura Weber. I am the manager of Crisis Connection. Thank you, Mr. Chairman, representatives. When someone texts in, they clearly have the text messages on their telephone. That is handled by their carrier. And so when the texts are deleted off of your phone, your carrier has access to them. It's been described to me as a big pool. It's a big bucket of texts. It would take a while to individually pull messages out, but in reality, they are capable of getting our text messages out of their, let's say, whatever your carrier is, their pool. In terms of our platform doesn't store text messages in a way that we could pull them back out. It's merely a vehicle for us to communicate back and forth. The text conversations then are recorded in an electronic record system in a one record format where there's some specific information, phone number, time of start, time of stop, things like that, and then a basic description of what happened. And that is stored in an electronic record system by the phone number. We don't have a elimination date on that, but we can certainly, at any time that we desire it, say after 7 years, these are deleted in the system. What we do in the case of a conversation of text messaging, we alert the texter during the message and at the end of the message that this is on your phone. It's not confidential because it's on your phone. And if you want it off your phone, please delete it for your own privacy. So that's how we handle that part of it on their side. On our side, we handle it according to HIPAA guidelines like everything else in the behavioral health care world.
Representative Franzen. All right, thank you for that. Representative Allen.
Thank you, Mr. Chair. My question is in putting it in the Department of Human Services as opposed to the Department of Health. So the health equity leadership that the Department of Health has undertaken, and they have various grants that are granted to communities that directly serve populations that are, you're talking about tribal communities, reservations, urban areas, rural communities. So the do you have similar to what Representative Flanagan was asking, the cultural competency and those relationships that the Department of Health has formed with with nonprofits serving tribal communities? Because it's my understanding that some of them are doing this type of using texting, because I believe the CDC provides some funding to some organizations that serve tribal communities in urban areas. And so I'm wondering if you have the same sort of people in place in the Department of Human Services that are similar to the individuals that are running the health equity programs in the Department of Health.
Dr. Eastwood.
Mr. Chair and Representative, to be honest with you, I'm not familiar with those individuals, so I can't really speak to that. I can say that we are working with and in communication with the Department of Health as well as Department of Human Services on the work that we're doing, so they're certainly familiar with us but I can't speak to the skills or some other grant funding. Our funding for Text for Life comes through the Department of Human Services currently.
Representative Allen.
Thank you. Even within the Department of Health, given their efforts to develop the cultural competency, there was still issues with, I think it was a $3 to $5 million that was there was available for grants to address health disparities, racial health disparities, and so and it was often that a lot of it was more work needed to be done, technical assistance needed to be provided to some of the organizations so that they could they could be competitive in receiving the grants or applying for the grants. And so I think a lot of work needs to be done at that level, and I think the Department of Health is trying to reevaluate how that grant making process works, and so that it could get to those organizations that have the relationships with the people they serve to develop that competency.
Any follow-up to that?
Thank you, Mr. Chair, and that's something, I know that the Canvas Health is in constant communication with Department of Health, Department of Human Services, and that's something that we can look at and work together on in the future as this progresses down the road. So thank you, Representative Allen.
All right. Any further questions for Dr. Eastwood? Representative McDonald.
Thank you, Mr. Chair. Last question for Dr. Eastwood or maybe Representative Fenton. According to a Pew Research, 63% of teens prefer texting. Now, that's 2011. As you know, it's 2017. I don't know about your teens, but my teens Snapchat all the time in their instant messaging as of 22% of 2011. I would think those numbers would be flipped as of today. Is there any thought, or is it any thought, or do you think it would be a good idea to perhaps look into that, or perhaps they have, into instant messaging in addition to text messaging for this suicide prevention program?
Dr. Eastwood.
Mr. Chair and Representative, I think that's a wonderful idea, and we're constantly looking at what technology is available, but also what we can afford to implement. Certainly, as different tools become available to us, whether it's FaceTiming with voice, or instant messaging, or Snapchat, or the other 100 things that are out there today, we will certainly continue to look at that and move the technology forward with the tools that kids are using. But at this point, it seems like text messaging is still pretty high on that list. I think there's a lot of instant messaging between kids because they want it there and gone, and text messaging seems to be pretty effective at this point. Much more effective, honestly, than voice. Historically, Crisis Connection would get about 150 phone calls a year from teenagers. Very shortly into the Text for Life program, we're at 11,000. It certainly tapped into where kids live and how kids communicate today, but we'll certainly continue to look at new technologies as they come along and implement them when we can.
All right. Any other final questions for Dr. Eastwood? Seeing none, Dr. Eastwood, the committee thanks you for your time this morning and for your work on this project. Next, we have Ms. Mulvihill to testify on the bill. Welcome to the committee. If you could please state your name for the record and give us your testimony.
Good morning, Mr. Chair and members. I'm Shannah Mulvihill, Executive Director of Mental Health Minnesota and co-chair of the Mental Health Legislative Network. I'm also a former Crisis Connection volunteer. First, I'd like to express the network's support for the proposed bill to provide funding for Crisis Connection and Text for Life. The network has long recognized the importance of building a comprehensive mental health system in our state that meets the needs of people living with mental illness. Access to crisis services is a key part of meeting that need. The suicide rate in Minnesota hit a record high in 2015. Services like Crisis Connection and Text for Life help people across Minnesota who are struggling. They offer more of an upstream level of service that's a crucial part of the continuum of mental health services across our state. I know because I've been a part of the work in the past. I completed my master's degree in counseling in 2008 and did my clinical work at Crisis Connection. That means I logged more than 700 hours at Crisis Connection and took hundreds of calls during a 9-month period. Calls at 2 in the afternoon, calls at 3 in the morning, calls from people who were struggling with difficult symptoms from their illness. isolation, and suicidal thoughts. I wanted to share one story that has always stuck with me. One afternoon, I took a call from a young man who said he wanted to end his life. He was calling from his cell phone and standing on the lift bridge in Duluth. I spent more than an hour on the phone with him, eventually able to get emergency personnel out to him to help give him the help that he needed. As the police officer approached him after that hour or so, he cried and thanked me for my help. I've gone to Duluth on vacation every year for a lot of years, but I've never looked at that bridge the same. I don't know what would have happened if I hadn't answered that call, but I'm really grateful that I did. I'm really glad that there's a place for people to call when they need it. Thank you for the opportunity to express the network's support. I appreciate it. Thank you.
All right, thank you, Ms. Mulvihill, for your testimony this morning. Questions for Ms. Mulvihill? Seeing none, the committee thanks you for your testimony. Finally, on the list today, we have Mr. Watson. Welcome to the committee. If you could please state your name for the record and give us your testimony.
Good morning, committee members and chairman. My name is Wade Watson. I'm a critical care paramedic for Lakeview Hospital out of Stillwater, Minnesota. I was asked today to come maybe speak on a professional basis and a personal basis. We've been affected in the world of EMS with a fellow paramedic committing suicide approximately 4 years ago, a firefighter that we work closely with 3 years ago, a police officer 2 years ago. It affects our profession quite a bit. We tend to think that we are the people who come help you, and we often forget to ask for help ourselves. We tend to see a lot of accidents and incidences that affect us on a pretty deep level, and we internally try to bury them, I would say, sometimes without a lot of success. Text for Life, we got associated with Canvas Health probably 4 or 5 years ago in a fundraising effort to gain attention to suicide and suicide awareness after that fellow coworker and friend committed suicide. We wanted to support a local organization in a fundraising effort, and Canvas Health was a perfect match for us. Ever since, they've done everything to show us kind of the internal level. I'm not sure how familiar you are, many of you are, I guess, with just the 911 system. When somebody truly has a problem, 911 is activated, we get out there on scene. Often this person might go down to the emergency room or a care facility for 2 or 3 hours of an evaluation by a doctor and get told to maybe seek some help later. That truly doesn't, I think, solve the problem, especially if it's an acute suicide or mental health crisis that that could be maybe a potential suicide or a potential life threat. This program in Text for Life, I think, offers an opportunity to these people where it's a little bit more confidential. It's a specific person on the other end of the line who's dealt with this situation. And I think they offer something that our service as a paramedic, 911, emergency room facilities just don't understand. I would assume that many of you are seeing, both via the news and maybe personal life, the problems with mental health are just dramatically increasing. The last couple years, our call volumes for mental health crisis, suicide, are just astronomically growing. So my job today was here, I don't know, probably just to help give some insight on that level, and I'm happy to offer some insight on where I see this problem and the benefit of Text for Life. It's a great program that I think can help a lot of people in that moment of panic and moment of I don't know, problem.
Thank you, Mr. Watson, for your testimony and for the perspective that you bring to this as well here. Are there any questions for Mr. Watson? Representative Murphy.
Thank you, Mr. Chair. And for the testifier, you referring to the rate of increase of calls that you're getting. And I'm wondering if you have anything to share with us about why the rate is increasing.
Mr. Watson.
So just in my service alone, we offer 3 ambulances, basically at 24 hours a day in Washington County. We're based out of Stillwater, Minnesota. We cover anywhere from western Wisconsin over in Somerset, New Richmond area, all the way to North St. Paul, down to 94, almost to Woodbury, and up to Marine on St. Croix, Scandia. Our volume in the last 3 years has gone from about 4,000 911 calls to this year we're over 7,000. I guess my idea of behind it, one of the things is population. I think our population in the last couple of years has grown, but also the social economics, the economy and the stress I think that we've seen in the last 3 or 4 years has probably added to a lot more mental health based calls on the 911 service. I don't know exactly specifics, but that's probably one of the bigger ones. I think it's okay maybe to talk about it. There's a generational gap where my parents, even maybe myself, as opposed to the 20-year-olds, that technology aspect of texting for help, that wasn't even considered back in my day, my parents' day, whatever. And I think that's an outlet now or an opportunity to at least use your voice, use your text, use your ability to ask for help.
Representative Murphy. Any other questions for Mr. Watson? All right, seeing none, Mr. Watson, thank you for your testimony this morning.
Thank you, guys.
Mr. Chair, I also have a member from a tribal member, Lori Nelson, here to testify.
All right, Ms. Nelson, if you could make your way down to the testifier table. And if you could please state your name for the record and give us your testimony.
Good morning, committee. My name is Lori Nelson. I'm from the Lower Sioux Indian Community. I hold a position of chemical dependency worker, and I was asked to testify on behalf of Text for Life. I have 2 letters here, one from Chairman Jensvold at Upper Sioux Community, supporting this, and one from our tribal president, Robert Larson, supporting this as well. I just want to talk a little bit about my experience as a community member and as a person who has dealt with a lot of our children and their pain growing up, on the reservation. One of our youngest people was 12 years old. Our president has stated that we've had a flurry of deaths of our young people to drug overdose and suicide. And like I said, our youngest one was 12 years old. Text for Life, I believe, is very important as far as our kids these days, as that's the way they communicate. And whatever kind of tools or avenues that helps them communicate their pain and to reach out would be beneficial to saving our children. Text for Life is funded by DHS, and it's been successful there, and it makes sense to stay there. And the approach through the Department of Human Services, Text for Life, takes in partnering with tribal nations. It's effective and culturally responsive. It's competent. Text for Life helps programs take direction from tribes themselves, what is best as determined by each tribal nation. I'm also the chairwoman for the Parent Advisory Committee for our Indian Ed Department for Redwood Valley School System. And we're trying to address these kind of things. Like I said, we've lost quite a few people, young people, 12 being the youngest, and 3 brothers that we've lost in our community. So whatever kind of tools that we can help to have our children stay with us is very important as a tribal nation. So on behalf of one of the 11 Minnesota reservations, we would like to know that we support Text for Life. Thank you.
All right, Ms. Nelson, thank you for your testimony this morning and the perspective that you bring to this program. Questions for Ms. Nelson, Representative Kresha.
Thank you, Mr. Chair, and I'm not sure if it's directly to this testifier, but just a general question to the bill author, and that is having my own kids that text and all that. I know sometimes they'll get each other's phones and they'll send texts. What happens in the case where someone sends a text in a jokingly manner that could be misconstrued in the wrong way?
Representative Fenton.
Thank you. I think I will allow Dr. Eastwood to answer that as they deal with they take in the text messages on a daily basis.
All right. Dr. Eastwood, if you'd like to come down, and Ms. Nelson, if you can stay close, because I think we do have a few questions for you, too.
Eastwood. I apologize, we're swapping out. The technical piece of the service is that both call and text, our goal and our duty through our accreditation and best practices, that we respond in a least restrictive manner. So that also means on the other end of it that we take every text and call seriously. We do note that we get some pranks, both on call and text. Teenagers will do these things every now and again. And so if we get a text message or a phone call where someone is stating they're suicidal or there's an intent to harm themselves or someone else, we think there's imminent risk involved. We will then ask for emergency services to respond to the home. There are times when, let's say, a sheriff's officer will present at the home and find that the child was watching TV with the parent or whatever, and they were just messing around. That's an opportunity to say, this isn't messing around, this is serious. You told us you were intending to kill yourself. We will get a response to you if at all possible. So pranking is one thing, but we don't know on a call or a text if it is a joke. So we are going to respond every time that we can.
Representative Kresha.
Thank you, Mr. Chair, and thank you for that. So the testifier, so do you have the percentage of those? How many are actually false positives like that? And also, it sounds like if you do that, services will be engaged and somebody's going to pay for that. Does that then get billed to the parents?
Ms. Weber.
Thank you, Mr. Chair. Representative, I don't know what happens on the back end of that. All I know is we have an imminent situation. We are asking for a response. How it's taken care of on the other side, I don't know. Sometimes, not a lot in those situations, but sometimes the officer will call us back and say, this is what happened. And that's good for us to know. However, what I tell my staff is, okay, this one was a prank. You don't know about the next one. We're going to respond every time.
Representative Kresha.
Thank you.
Representative Moran.
Mr. Chair, I think my question is for maybe Dr. Eastwood, maybe. So I was just looking at the map again, and I'm not quite sure what the little blue dots are, but looking at the 7 metro county area, urban, I don't see much engagement there. So as part of your expansion, well, I guess one, why is it not any support in the 7 metro county areas? And what is your expectation moving forward?
Dr. Eastwood.
Mr. Chair, Representative, that is correct. We're not currently in the metro area. The program started in northeastern Minnesota and has spread around the state. With the resources we had and our ability to respond to those text messages, we moved into areas that both asked for the services, wanted the services, and where we thought we could handle the volume coming from there. I will say that we respond to text messages from every county in the state of Minnesota currently. The difference being we simply do not yet have, if you will, boots on the ground in Hennepin County and Ramsey County with regional coordinators who are going out to the schools and doing the educational pieces. Once the information is out, which it is, of course, on the internet, and you can find it very easily, you start receiving text messages. So we do respond to people in the metro area. We simply do not yet have the regional coordinators in those areas. And part of the reason for that, in all honesty, is this is a very new technology and it's growing. And we were a bit concerned that if we went right straight to the metro, where a large portion of the state of Minnesota resides, that we would be overwhelmed in the text center and unable to actually respond to all of the text inquiries that we had. We didn't think it was going to be very helpful if we got overwhelmed before we really got off the ground and got started. We would expect with this expansion that we would cover and have regional coordinators in all parts of the state, covering the entire state and responding to all the text messages we might receive.
Representative Moran.
Thank you, Mr. Chair.
All right. Any further questions for any of the testifiers we've had so far? Seeing none, the committee thanks you for your testimony. Is there anyone else in the audience who wishes to testify on House File 501? Seeing none, are there any final questions from members for the bill author? Seeing none, I will officially call the meeting to order. And then I will move that House File 501 be re-referred to the Committee on Health and Human Service Finance. All those in favor signify by saying aye. Aye. Opposed, same sign. The bill is adopted, and House File 501 is re-referred to the Committee on Health and Human Service Finance. Thank you, Representative Fenton, and the testifiers.
Thank you, Mr. Chair.
For your presentation this morning.